Go ahead and describe it to me, like what you feel.
Like it gets stiff, like if I'm turning from side to side, it just feels like stiff. If I put my head back, there's kind of like a sharp pain that goes up my neck.
On the right hand side?
Just like in the middle. It
Oh,
doesn't
in the middle.
really.
Okay.
Yeah.
And then yesterday you said you had a bad migraine.
Oh yeah, it was terrible. It was, take days off. It was all around here, the back of my head, and it kind of went all around. So this whole side of my head.
Okay. And do you have it now at all? Like almost like a hangover from, they call them like a migraine hangover. No. I'm curious about the organs and all that stuff, so I'm like, but your neck is really tight.
I told you you'd be surprised. That's always where I massage when I get headaches.
I believe you. There we go, a little deeper. This moves just fine. Very good. Okay. Cracking is over with, all right? Not sure I need, yes I do. I need the napkin. Big toes, I just can't, they're separating, like they're moving, but they're not really popping. Okay, it's fine, it's fine. Baby toe. Okay, nothing,
That's sensitive.
so that's why they thought it was appendicitis.
Yeah.
Okay. In reality, they checked your appendix, right? With the ultrasound, nothing came back negative.
Yeah.
So it could just be, and they didn't even say why?
No. They completely went on to something else.
Okay, feel this side. It's interesting because this is the side where the fecal matter gets harder over here. As it goes through your intestines, it gets drier and drier and drier, and then it leaves your body. Everybody, okay? You're sensitive, yes, right? We call this McBurney's point. It's just that you didn't feel pain like around your belly button first or anything like that. Sometimes that's a hallmark, like pain here that migrates down into here, but it doesn't always. Now you're sensitive right at the ileocecal valve, and that is hard. This area is hard. It's supposed to feel like this. Go ahead and feel it. That's kind of hard.
Yeah.
It's supposed to feel hard over here. We call this McBurney's point. Here's the, you feel the, you know, the bone here. You have the hip bone, the ASIS, and then you go to the belly button. Do you kind of understand that? Here's your hip bone.
Yeah.
Here's your belly button.
Right, okay.
You press in.
Hi.
That's a positive McBurney's. But when a patient does that, ow, you send them to the ER, pack and ship. Okay, but we just had you cleared, and there isn't anything there. Okay, she doesn't have any fever. She doesn't. Are you regular though? if she hadn't just been there yesterday, I would have been like, oh my God, it's appendicitis. Go to the ER. You know what another telltale sign is though? Is if I push in here and you hurt over here.
It hurts right here.
But not here, right? It would have been like further over this way.
No.
Now she's pointing here. Yeah, she's pointing somewhere else. Not down into here at all. Okay, these are ovaries. All right. Hey, there's nothing. I mean,
Yeah.
you know, we all got them. Let's hope.
Yeah.
We got 2 of them. We got one here, and we got one here. Bladder infection is suprapubic pain here. Okay. I'm just educating you because I don't want what happened last time to happen again. Okay. This is bladder infection here. Not always, but classic. Now I'm gonna like try to go around this thing. All right. Can you handle this, or is that just really super tight?
That's fine.
Liver feels good. Can't feel the liver. You're not supposed to be able to feel the liver. So when I say it feels good, it means I can't feel it.
Yeah.
Okay. Kidneys are back here.
Yeah, I know those.
You know those. Okay. Which one was the one that was infected?
That one.
Okay. I usually take these and squeeze. You can feel your kidney right here. Very subtle feeling. It's not like I can just feel it.
Mm-hmm.
You can feel it kind of as it pops up. You feel the vibration as it hits your hand. You kind of flick it. You can feel it. It's right here. So I'm checking all the organs to make sure it's not something else besides your colon.
Okay.
This is the ascending colon. Can I go deeper? It might be a muscle. It feels awfully tight.
Yeah, that hurt.
Does it hurt just pulling your knee up?
No.
Press up against to like your knee towards your chest. Does that hurt?
Mm-mm.
Does this hurt down in here?
Yep.
That's like the outside quadrant of it, you would say?
Oh, yeah.
Yeah, into here?
Yeah.
Okay.
Sorry, I'm not trying to like
No.
twitch.
No. Do you understand that this is a muscle? Oh. This is what was hurting you while you went into the ER. Yes?
Yeah.
What were you, when did this start? I know you told me, but tell me again.
Well.
I need to know, there's something I'm missing from the story, so go ahead.
Because the stomach pain was on this side
Okay.
originally, which is why I went to the urgent care, and that was 3 weeks ago, I think. 3.5.
And then how did this start?
She was palpating just like you were, and then got to there, and I was like doing the same reaction. Like it hurt just really bad.
But you, right, see, when you have stomach pain mixed with, that sounds like very, very much like appendicitis.
Yeah.
So it wasn't a bad thing that they went and did an
Yeah.
ultrasound, okay? I know,
Yeah.
don't be like, oh God, I paid for this thing, because I would be sending you there if it wasn't for that.
Oh.
It's okay, it's a strain, I'm sorry. If you want me to stop, I can. I can give you a break. Give you a break. If it wasn't for the fact that it keeps getting smaller as I do it, I wouldn't continue. Okay. Right there, still pain?
Yeah.
Okay.
In there.
Yep, that's a lump there. Feel it with your hands. There. Bloop, 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 bloop. You feel that?
Yeah.
And relax, I got you. Push up on my hand. Oh, God. Okay. Create some space. Create some space. No pain up here though, right?
No.
One more time, okay?
Okay.
Because I think this is, you're about like tapping out on me. Okay, you're like, and I'm done.
That wasn't bad.
I want you to practice this. Taking this and pulling this up.
Okay.
Working with it. Don't be afraid of it. We've already ruled out all the bad stuff, okay?
Okay.
So you're not going to hurt anything by doing this. All right, deep breath in, all the way out. Very good. Deep breath in again. Okay, a little tight there. Deep breath in again. Again. And again. Breathe. Trying. I'm trying to create space here. This feels good. This feels nice and smooth. No scar tissue. This arm behind your back for me. Yeah. Okay, you can put that arm down. Tuck your chin for me a little bit and then like kind of lean it to the side. Yeah, like I can get in this corner. That's it. keep breathing. That's it. Huge trigger point right here. But that is just something else right there. Doing okay?
Mm-hmm.
Lower the shoulder down for me just a little bit. That's it. Ugh. Doing okay?
Mm-hmm.
Ooh. Now this is superficial. This is about maybe an inch, okay, into the tissue. Let's go in with my elbow right here and press down like that. Here's the scraping.
It's not what I expected it to feel like.
What did you think it was gonna feel like?
Like scraping.
I'm doing like a general, like, let's see, general sweep here. I don't think she's gonna bruise that much.
Oh, darn it.
Oh. I just have it's not bruising already, and I don't like applying too much more pressure than this. Man, I'm pushing hard on you. Nothing.
Are you?
That's hard, yeah.
Oh.
Compared to most people, that's me pressing really hard. Like, I'm gonna try to hold these ribs in as I do it. There you go. I thought for sure maybe here. You know what? I'm not a bruiser either. I feel like a ridge here, an old rib injury here. I have been pushing here for a good 5 minutes, and just for here.
Because before it was like I'd do it and it was just like, oh, yeah. Oh.
Head back for me though. There it is. Perfect. Other side. Okay. There it is. Press outwards for me. 2, 3, 4, and 5. And then we squeeze. Good. School's getting out. Okay, squeeze. There it goes a little bit. That's all I need. Okay. A little bit. You've got it in your neck here.
I was about to say, that feels like what I was expecting it to feel like.
Oh, that's a little painful?
It's fine.
Okay. You let me know, alright? There's just a tiny bit here. It's not bad. You know, right where you're saying you have issues.
Yeah.
Nothing horrible, trust me. We've seen worse in here. I'm still having to push, you know, and
Yeah.
it's actually, you know what it might be is I'm struggling with the fascia. I'm gonna go this side. Ooh, okay. That one is just, that one came out like nothing. Like I didn't even push this. I'm just gonna be quiet here. Wow. Turn towards me just a hair, like your whole body, yeah, right there, just so I can get into this corner. I'm gonna have to stop on this one. She's not bleeding yet, but it's like, it's close. See this left shoulder? I know you can hear it probably too.
Mhm.
This side just isn't there, you know? Surprisingly, more petechia came out on the left-hand side. You can relax your head if it feels better to look straight or. That's it. That's all I can get. Okay, relax that shoulder. Want to take a picture of your neck?
Sure. Oh yeah.
It's just your neck.
Which makes sense, cause
That's your symptom.
Yeah.
But like your low back, I couldn't pull anything out.
yeah.
I tried. I like tried for like 5 minutes.
Literally,
but
like my neck is the only thing that really bothers me all the time, like every single day.
take it back. How does it feel? Before you had discomfort, so I'm just wondering if it's eased up at all.
Oh yeah, I totally forgot I said that.